A really common and important part of microbiome health is actually parasites, not having parasites. And parasites are really common. There's a really great book called Guess What Came to Dinner, and it estimates that at least 35% of the population has parasites. It's probably higher than that, truthfully. And parasites are, if you eat sushi, if you go out of the country, if you have pets, you probably have parasites. And we don't really treat them frequently like most of the world, honestly. And those parasites can actually go extraintestinally. What that means is they can actually migrate to other parts of the body. They like the gallbladder, they like the liver, but they can go into the interstitial space, which is the space between the cells. They go to your lungs, your skin, your eye. I mean, craziness, right? And they actually will have an impact on your mood. I have seen patients depression, long-standing, disappear when we clear the parasites. It's not always that simple, but I've seen it. They do have an impact, and they get more active at the full moon. So if you did a parasite cleanse, or you're doing a parasite cleanse, or you want to do a parasite cleanse, you want to get that you then need to actually treat those parasites over the full moon for, say, 10 days over the full moon every month, possibly for a year and a half to 2 years. Okay, because they can have reservoirs of unactive forms that then become active over time, especially if the immune system gets suppressed, your stress gets up, like things like that. And so you really need to keep clearing out those little reserves of parasites going on. And they're missed a lot. So we do a lot of GI panels, and it checks for some of the really common parasites, and that doesn't even catch everything because, there's thousands. Testing doesn't always catch everything. So we actually use muscle testing and bioresonance testing to look for that full picture. So make sure you're getting all that done. Hope that helps.